Imagine this. A mother walks into your clinic carrying her 2-month-old baby girl. She looks tired and worried. "Doctor," she says, "my baby barely wakes up to feed. She sleeps all the time, hardly cries, and when she does, it's soft and weak." You gently lift the baby. She feels floppy in your hands. Her movements are sluggish. Her skin looks dry, and her tongue seems a bit too large for her tiny mouth. And the anterior fontanelle feels wider than you'd expect for her age. When you ask about feeding, the mother explains she used to breastfeed well, but lately she falls asleep halfway through. Her stools are infrequent and hard, sometimes only once every couple of days. The baby looks peaceful, maybe too peaceful. She's not in distress, but something isn't right. What could cause a baby to be so quiet, so sleepy, and so hypotonic, yet not acutely ill? That, my friends, is the classic presentation of congenital hypothyroidism. Subtle at first, but serious if missed early. Before we get into the causes, let's quickly remind ourselves of the organ at the center of this condition, the thyroid gland. So, what exactly is the thyroid gland? The thyroid is a small butterfly-shaped gland located in the front of the neck. It plays a huge role in our body's functions. It produces two main hormones, thyroxine, T4, and triiodothyronine, which is T3, both of which regulate metabolism, growth, and overall development. Its activity is tightly controlled by the pituitary gland, which releases TSH, or thyroid-stimulating hormone. When thyroid hormone levels drop, TSH increases to push the thyroid to work harder. Conversely, when thyroid hormone levels are normal, TSH decreases. Now, here's a key question. Why is this condition so important to recognize early? Because congenital hypothyroidism is one of the most common causes of preventable intellectual disability. Yes, preventable. That's why understanding it well matters so much, as that can make a real difference in patient outcomes. So, what actually causes congenital hypothyroidism? Most of the time, it's because of something called thyroid dysgenesis, meaning the thyroid gland doesn't form the way it's supposed to. In other words, it doesn't develop normally. Sometimes it doesn't form at all. That's called thyroid agenesis, meaning the thyroid is completely absent. Other times it does form but remains underdeveloped, which we call thyroid hypoplasia. And occasionally the thyroid forms in the wrong place. That's known as thyroid ectopy. But that's not the only cause. There's another important one, especially in some parts of the world. It is iodine deficiency. Guys, without enough iodine, The thyroid gland simply can't produce enough hormones, even if it formed normally. Now, here's something many students wonder. If these babies are born with a thyroid problem, why don't they look sick right away? And here's the answer. At birth, most babies with congenital hypothyroidism appear completely normal. That's because during pregnancy, they receive thyroxine, which is T4, from the mother through the placenta. This maternal hormone keeps things stable for a short while after birth. But as those maternal T4 levels drop in the first few weeks of life, the baby's own metabolism slows down, and that's when symptoms begin to appear. The slowing metabolism causes lethargy, poor feeding, constipation, and hypotonia, which means low muscle tone. On top of that, there's accumulation of matrix substances in the skin and tissues. This results in non-pitting edema, giving that classic puffy face we associate with hypothyroidism. Other signs include a protruding tongue, a large anterior fontanelle, and an umbilical hernia. So, why is early detection so critical? Because thyroid hormone isn't just about metabolism. It's essential for brain development and myelination, especially in the first few months of life. Without adequate hormone levels, the brain can suffer irreversible intellectual damage. Okay, let's quickly summarize the clinical picture. Newborns with congenital hypothyroidism usually look normal at birth. In other words, they're typically asymptomatic in the beginning. As maternal T4 levels fall over the next few weeks or months, symptoms appear. Lethargy and poor feeding, enlarged fontanelle, puffy face and protruding tongue, umbilical hernia, constipation, prolonged jaundice, and dry skin. All right, how do we confirm the diagnosis? It is through thyroid function tests. The classic findings are high TSH levels and low free T4 levels. That's why several countries have routine newborn screening programs that measure TSH and T4 soon after birth to detect these cases early. And once the diagnosis is made, what is the treatment? The treatment is simple, but time-sensitive. Levothyroxine, which is synthetic T4. The goal is to start therapy as early as possible, ideally within the first 2 weeks of life. When started early, the prognosis is excellent. These children grow and develop normally both physically and mentally. But if diagnosis or treatment is delayed, the result is permanent neurocognitive damage, including low IQ and lifelong consequences. So to sum it all up, Congenital hypothyroidism is a preventable cause of intellectual disability. Through simple newborn screening and early treatment, we can change the entire course of a child's life. And that's the beauty of early diagnosis in medicine. A simple screening and timely therapy can save a lifetime of struggle. Thank you for listening, and I hope this session helps you understand congenital hypothyroidism more clearly. See you in the next lecture.